while they're sorting that out. Our next presenter is Alsha Kritzinger. She's an OT that works in Mossel Bay. She's worked there for several years before moving to George, where she now works in the primary care services. And Alsha, thank you very much for coming. Alsha has a 7-week-old baby. So thanks for making the time for coming all this way.
Yeah, I told when I was asked to do this presentation, I was very optimistic with what you can do with her. I'm here, drop the baby off. Any case, so yeah, I've been working in Mossel Bay since doing my conserve here, and then actually just starting this year because I moved to George at Hypoxic-Ischemic, the TB hospital. And then I had the privilege of actually getting in the primary sector the biggest clinic in Timbalete, and then the furthest one in Uniondale. So that's got its challenges. But I was born on a farm, actually in a primary clinic. With a mum being a social worker and a dad being a farmer, so I quite love the rural areas. Although I know we're in George and in the Garden Route are quite privileged in terms of being rural, but still what we've got and to offer our patients. So I'm not going to go. We had a nice lecture now about the HIE, and so yeah. I'm going to talk a bit about my background and how we see and do things in this area, what works, what doesn't work that nicely. And then, yeah, I am Afrikaans, so please excuse if maybe I can't get you the right word, or if I sound a bit, my dad would say, like a donkey eating lemons or something like that. Okay, so yeah. When I started working at Mossel Bay, I soon realized that you should actually try and keep sort of a record of all your patients, because they do sometimes ask you quite urgently, give the names of your CP children, or there's a genetic outreach coming and now you need to give these names of the children. So that I started doing, and it's quite nice then having these lists and actually following up on these patients. Sometimes being difficult because numbers change as quickly as, don't know, but it changed very quickly. So yeah, I kept the records of the genetic disorders of my CP children, also those children with epilepsy. And then the problems that we have in the areas is always in terms of having too little or no schools for these children, and parents having to look after the children, not being able to work. And yeah, that's a big problem. And then in terms of transport, so now maybe if you've got the school, now there's no transport. And I mean, if we have the issue, I guess more rural is going to have even more of an issue. And then having staff that's actually trained to be able to assist and provide the good support and therapy programs that needs to be run, because there's just too little therapists in the area to actually do it full time being at a school. But we are very privileged in our area to have very nice schools. We've got Carpe Diem in George, and we've got some more smaller type of schools, Sterreweg in Plettenberg Bay. That also is nice schools, and a few private ones like in Mossel Bay. But then the other thing, funding, always a problem. So if you want to start something, funding is important, and actually funding going on. So because it starts off nicely and then everyone sort of disappears. So when I was in Mossel Bay, this thing of not having enough schools was a big problem. And from the beginning, we have Petro SA, which I assume is not going good, or it's not going good there anymore. But when they still had a lot of money, they were one of the stakeholders that came aboard to actually, for us to start this nice school. And if you ever drive past Mossel Bay and you drive, as you come from Cape Town, at the Asla Tunnel, there's actually this nice school built with like a sort of an astroturf in the middle, and it's got separate rooms, especially where we can see our CP children with bathrooms, everything very nice. But we also have challenges. So when starting a school like that, one thing I could just say to take home is that sometimes we move from something starts small, like with that one, it's also started like in a Wendy sort of house, and staff were transferred to when we got the nice bigger facility between like social development, Department of Health, education, everyone getting on board. But so we moved to the bigger setting, which was really what you would expect of a very high-end school. But then with staff, yeah, it's sometimes and yeah, of what's supposed to be happening at the school and why we actually opened the school in the first place. Yeah, like the criteria for who can it actually attend the school. Administration, again, funding, and the responsibility of who, because like when opening a school, one must remember that like the municipality like gave the piece of land, but when they're done with that, they actually sign over that in sort of a long-term leash where you pay like a ridiculous little amount for the next 100 years. But then whose responsibility is to upkeep things? Okay, so yeah. And then we have our challenges in the clinics. That, I guess, is everyone's problem with patients defaulting, with lots of reasons for why. Files getting lost. Yeah. In any case, I'm not going to go on long about that, but yeah. So one thing that I can also brag about in George Hospital and Garden Route is our seating services. So once a child is actually got now the severe diagnosis of being CP, we must actually do a lot of support in terms of seating. So our therapists, I think it's about 80% of them is actually trained in intermediate seating. For those that don't know, you actually have to attend a week course just to do basic seating, another week for intermediate, and another week for advanced. And that's where you seat the advanced, like your children with severe scoliosis and deformities. Because believe me, that's difficult. It's really hard. So we are privileged in George sub-district to have those therapists trained, and that can actually take the service to the peripheral different sub-districts. So at present, how we function is that if there's a problematic case, which you as a therapist in a sub-district can't sort of sort out, you can refer to the George District Hospital, where we have different days for the seating. That works actually nice. And if then you can refer down back again for follow-ups. So from there, we also have different budgets where we can actually source the cushions on tender. And we're actually one of the, there's another donation company that's actually supplying wheelchairs. That's actually the same on the tender, but because for us it's a problem, and that's the other thing for repairs on wheelchairs. So yeah, but that's actually functioning quite good. We have a budget for doing that. It's now been kept at where I am at Harikuma Hospital because you have the space, because wheelchair parts take up a lot of space. And then if any therapist actually needs anything, they can just ask for it and we can send it via the ambulance, via transport. So that works really nice. And for the CP child, that's one of the biggest things that I think you can do for the family, is being able to transport your child, doing it safely, and actually providing the proper support for that child. Yeah, so me having a baby myself now, I never thought I could have baby blues because I'm quite active. I do renovations and I keep myself really busy, but having a baby, it changed your life. Yeah. So there's a lot of emotions. And I know for me, just having a baby with a bit of jaundice was quite challenging, because you've got all these dreams, and then things doesn't work out the way you want them to work out. So yeah, emotions, and I think for the mum with the HIE baby, it's even so more devastating. So, and with a lot of problems. And I think one thing I didn't mention is, like, in 2018 with our dietitian, I got my qualification through Wits University as a certified lactation consultant, which is actually very nice, because like Dr. Bosch also said, that feeding is one of the biggest problems for our babies. And I feel strongly, and that's one of the things I think we need to take home, is that when things start, that's the one thing the mum can still do for the baby. And sometimes even if it's just providing the breast milk, because we send parents home, and now we've been we haven't done as much to make sure mum is actually having good milk supply, and she's going home with something that she can actually upkeep, and not having to buy formula and things. And the emotional bond you have, even if she needs to, and I know we're baby friendly, but even if she does need to then feed the baby with a cup or a bottle or whatever, that mum can actually do it. So one of the things, yeah, I can just add, I said now with the bonding, just going to skip that one. So you get your mum that if she can feed the baby, she actually gains confidence. And this is the very first thing for mum with a CP child. If you bond with your baby, and yeah, your outcome is going to be better. That's the mum that's going to actually bring that baby to attend therapy sessions, because feeling from the start that you're being looked after and someone cares is going to make you want to get more invested in your child. Yeah, so that's just a few pointers for, like, when you evaluate a child and you look to where you must actually assist the child. So your child that's actually showing stress cues while feeding, uncoordinated, holding his breath, panting, unable to latch. So the list goes on. I'm not going to read it all, but I know when I was in Mossel Bay, and actually when I got my qualification as a lactation consultant, I started to get more involved in the NICU area where the babies was lying, and help assisting parents that had to feed babies with the nasal tubes, or yeah, and having them actually, but giving them alternatives way to feed the baby, and showing them that it's actually something they can do themselves, giving them hope for when they take this baby home. So then also not going to go through all of them, but there's a few reflexes and things you can actually check when you have the HIE baby and that's got the poor feeding feeding problems, that you can actually check out and see if this baby is in need of more assistance and help. Yeah. So, and then when feeding the baby, actually doing grading. And I must just say, always, if there's a speech therapist, but in our area, it's something that we don't have. We have physios and we have OTs at the hospital, but we don't always have the speech therapists there. So for me now, I'm lucky, so I can do a few other things as well. But yeah, doing then grading for feeding and getting mum to have the baby at the end on the breast where baby should belong or should be. So this is just one of the things, like with finger feeding, which is something that it's not, then people ask, but why do you do that if you can just do a bottle? But we actually want to have mum stimulate more, or stimulate this can be done by the breast as well, maybe if mum doesn't have milk yet, but having the right way of stimulating the baby's mouth so that the baby can actually learn how to proper suck and do that cycle between the breathing and swallowing to get actually onto the breast quite quicker. So that's just one of the things. And then, yeah, for one of the thing with HIE is that we don't always see the problem that the child may have CP with a physical dysfunction, But now baby actually ends up later coming to OT for having ADHD, not actually getting the good grades in school. Yeah, and then it's actually nice working with different departments. So we are lucky in George Subdistrict to have a nice team working for Department of Education that we can actually contact. So for me, I've actually got them on WhatsApp, but I mean, we do send the mails as well for this child that needs to be followed up. And I prefer like booking them back to me just to make sure that they actually did attend that. And some of the families actually do need to go to FAMSA or to getting actually a bit of emotional support from some of the other NGOs if there's problems at home. We get our behavior problems, which can be quite difficult to assist in, and there really a multidisciplinary approach is needed. Yeah, so family support, family support, family support. If we don't support mum, nothing's going to happen to the child in terms of seating, in terms of all the other things the child will need, and that's nothing new. So then I said a big focus on the seating. So at George Hospital and George, the district, we actually follow up on children. All children is actually intermediate cases. So we do follow-ups every 6 months because a child do grow and we do need to make adjustments and things do break and parents do adjust things themselves. We've seen, we as therapists started to take photos of the things people do and actually what a wheelchair can become. You would be quite surprised. But yeah, and then equipment sourcing that. And so in the picture, there's actually, that's it from Jeffreys Bay. One of Timian is a company that does the wood frames. So you must get quite your workshop. I'm privileged now to have my own woodwork area at Harikuma Hospital and having 2 technicians, OT technicians working there beside me, which is a great privilege, first time for me. But actually then having, being able to make these type of frames, you get some more easier frames that you can actually have and put up for parents to actually use. And yeah, then, so another privileged thing we actually have is having a clinic that makes all our, we call it the OMP clinic, which does all our prosthetics and prosthetics. So it's sometimes difficult to motivate if it's not a walking CP child to get AFOs, because why do we want it? And sometimes we don't need it because we change the gait of a child and making them even less mobile when we do give AFOs. So we have that specific clinic. We've got it at all the sub-districts and there's one at George Hospital as well. So we're a multidisciplinary team is actually where the orthopedic surgeon is, where the physio is, there's an OT, and all those involved and the orthotist to actually see that if this child does need it, they can actually give that. And it's at present we are working with a private contractor, which it's been going on for a while now. So the turnaround time for getting these devices is actually quite quick, because otherwise in the previous years our patients had to be sent to Cape Town, and by the time these devices came back, it wasn't fitting anymore. So now it's nice. We have our clinics and all the products get distributed to the different clinics as well. Yeah, and so there's other things as well. I did a bit of training in sensory integration. So that's also assisting and nice to have. So another thing, which is one of the very nice programs, and they actually, you can get this program for free from them. It's where you can actually train parents. And what I love about this program is it's got the different fields, so areas. So what I like to do is, because groups and starting groups for patients with CP is quite difficult, especially for attendance, because this time mum with label will come, next time no one comes. So that's quite frustrating for the therapist as well. So what I've now started to do is, rather, when I get a new patient, a CP patient, I will actually start this program. I ask them if they can get a flip file, and we put all these, as they come, these topics, and we do only a small bit at a time, but it's like mum having a booklet for what she can do with a child. And then it's nice because mum is feeling supported. And as what I try to do is rather book all the CP children on the same day, and if they happen to arrive together, we can do a quick group. So yeah, all the different areas. And then so just to take home, support the family to be able to support the child. And then a happy family, it's not only what happy wife, happy life, but it's actually a happy family also having a happy life. Okay. Thanks.
Thank you, Alsha. That was definitely very, well, I think you're very fortunate because seating is one of my other passions. So to have a seating service like that, I think is amazing. But also again, I think that was emotions of the caregiver and family support are really important things to remember. Alsha unfortunately has to go for her baby. So if you do have questions, maybe we can just pass it on, a few details if you want to get into contact with Alsha.